Here we go. Welcome everybody to The Big Idea. This is Dr. Jeffrey Hanna at Clear Chiropractic. Today we're talking about frozen shoulder and the cervical spine. Now, I'm going to say a few things first about frozen shoulder. We're not just talking about a rotator cuff injury, something like that. We're talking about where a person's physically not able to elevate their shoulder. And this is extremely difficult condition to resolve, and there is more than one thing that is going on here. It's honestly been one of the most tricky conditions that I've ever seen in my practice that usually involves combination not just of upper cervical chiropractic, but you need physical therapists involved, you need acupuncturists involved, you need massage therapists involved, you need myofascial therapists involved. In other words, a lot of people working together as a team to get the best resolution of issues here. But what I want to show you here is some really interesting research about a few of the dynamics that are involved and how frozen shoulder is not just a shoulder issue, that there are major connections that are going on in the neck. So let's jump in and have a look at that. All right, the association between cervical foraminal stenosis and adhesive capsulitis, aka frozen shoulder, an imaging-based case control study. These were a series of researchers who went back and they looked at 438 patients diagnosed with frozen shoulder syndrome. And they went back and had a look at their MRI scans of their cervical spine, particularly looking at the joints in the lower neck. And let me explain a little bit about what a foraminal stenosis is. So you've got the individual vertebra in your neck like that. The foramina refers to the opening through the sides of each of these vertebra, the joints between the disc spaces, where the nerves come out and ultimately supply the different parts of your body. So not only are there a series of muscles that are going to anchor between your neck and also toward your shoulder, but you've also got the nerves that come out of your neck that controls how those muscles are able to work in the first place. Here's what the researchers found. They found that of these 438 patients, that 25% of them were also experiencing neck pain. No surprise really there. I've talked about this any number of times, how a neck issue can show up a lot of different ways, including the shoulder. With 48 matching the study criteria, they were being very, very specific about who they were looking for. They found a significant association between ipsilateral frozen shoulder and a C4, C5 foraminal stenosis with an extremely high degree of probability. So what does this mean? Ipsilateral first means the same side. And I should have said this before. Stenosis means a narrowing. In other words, they're finding that if a person's not able to move their shoulder on a certain side, that the opening where that nerve comes out of the neck is narrower. That's what stenosis means. Narrower. An extremely high probability. They found that that was true in 57% of the cases, but an additional 29% of cases had it on both sides. And this is not uncommon because if you ever have physical damage through the joints in the neck, it usually doesn't affect just one side, it can affect both sides. It just so happens to be which side is under greater stress, greater duress. So what would we have there? We're talking about a grand total of 85% of cases of people with frozen shoulder. They've got a narrowing of the opening at the C4 and the C5 region in the C5 nerve root that's going to be supplying control to that shoulder. Additionally, 78% had neck pain on the same side of their frozen shoulder. 44% had pain radiating to the shoulder, so shooting down, maybe even going to the hands. 48% underwent targeted nerve interventions, 44% addressing the C5 nerve. So what does this say in a nutshell? It's saying that if a person is dealing with a frozen shoulder injury, one of the most important areas that you need to look at is going to be the lower neck, because if there is a mechanical problem there affecting the electrical flow, guess what? You can do all the rehabilitation focusing on that shoulder in the world, but it's not necessarily going to get the breakthrough that you are looking for. And maybe this is one of my biases as well, why I say frozen shoulder is oftentimes a very difficult issue to resolve. Most of my focus in clinical practice is we're working on the C1 and the C2 area, the region in the upper part of the neck. But I've known for many years that as much as I'd like to say, oh yeah, that's the solution for absolutely everything, that is not true. And I do focus in the lower part of the neck, but maybe I need to be spending a little bit more time there in order to help resolve these different kinds of conditions. Now, even then, I do want to share a little bit of my own clinical observations as it relates to frozen shoulder syndrome and why it may be such a difficult condition to resolve, and again, why there need to be so many different approaches: physical therapy, acupuncture, massage, the full gamut. So let's have a look at a couple little videos here. Okay, what are we looking at here? We're looking at a top-down view through the joints in the upper part of the neck. So right here we've got the C1 vertebra, and then you've got its major pivot point, the C2. And there's a very important muscle that goes and attaches directly onto the C1, the C2, the C3, and the C4 that goes directly to your shoulder blade. It's called the levator scapula. My point, simply put, is that there are direct attachments from the upper part of your neck that go and coordinate how your shoulder moves in the first place. And I'm going to, for the sake of illustration here, give an example as if a person's had physical injury which has caused that top vertebra to misalign this way. Essentially, we're saying it's misaligned like this toward the left side, producing tension, not just on the one side, but on both sides. Now, this is not a condition that causes your spinal cord to get compressed or stretched or anything like that, but instead what it does is it can produce local little bits of irritation. Brain's not going to be very happy with that, and it's going to try to produce normal compensations in the neck, but also as it goes down into the rest of your spine, and your shoulders are going to be no exception to this particular rule. Now, that would be an example as if a person's only had one physical injury, and this is going to be my point. Most people who I see in clinical practice, they have had more than one slip, more than one trip, more than one fall, more than one car accident, more than one event in the course of their life that's potentially caused physical damage, injury to the different joints of their spine. In other words, it's possible not just to have one layer of issue, but you can also have a counter-rotatory issue of the vertebra going down lower in the neck. And the way that I have illustrated right here, we're talking about a C2 misalignment. So the top one's gone to the left, the C2 has gone to the right. But if you have that kind of a misalignment, that can also originate from the level of C5. And because the joints C2 down through C5, really all the way down to your tailbone, are interlocking with discs that hold them in place, what usually happens is where one goes, the rest of them are going to go along for a ride. So what I'm illustrating here is that there's not just one thing going on, but there's potentially two things going on in opposing directions. So let's see what's going to happen to the body from that perspective. So in a normal, uncomplicated circumstance, we would see something like this, where that top vertebra is going to misalign like this, causing the head and the shoulder to ultimately drop down toward on that right side. Now, as I said, this is not going to be limited to just the neck. If you've got something that causes the brain to go crooked like this, you can see how my eyes are crooked. Brain's not going to be real happy with that. So what it's going to do is it's going to recruit the rest of the muscles in your body to compensate, which very characteristically causes one shoulder to look like it is dropping one side to the other. It can also cause tension that goes all the way down to your body, into your low back, into your hips, and oftentimes can create the illusion that one of your legs is crooked when in reality they're probably about the same length. Now, this is the normal compensation pattern that happens if there is only one thing that's going on. But what I routinely see in practice is when people have that counter twist phenomenon going on, what happens instead is that second layer causes your spine to actually compensate the exact opposite way. In other words, you've got one muscle pulling this way, you've got another muscle pulling this way. And the consequence, instead of the shoulders dropping out the normal way like this, they drop out like this, the exact opposite. And then over a period of time, that can lead to wear and tear in the joints, like we had said and like the researchers were finding. When you have damage to the neck starts to flatten out like this, and it starts to stretch, strain, lead to degenerative arthritis, wear and tear through the joints. And if you've got one muscle pulling this way, but then the other one pulling like this, essentially the body is stuck in a no-win situation, and the system can start to lock up and start to freeze in that position, that orientation. This is one of the things that I commonly see for people with frozen shoulder syndrome, is that their shoulder, when you look like this, it's actually tipped the exact wrong way, because there is not just the one issue going on in the lower neck, but also the issue at the top. You have to resolve both of those for the system to actually relax, to be able to untwist itself. In addition to that, if it's very chronic, you can have adhesions in the shoulder girdle itself. So what do you need to do? You need to rehabilitate that shoulder. You need to get motion and mobility through it. That's the physical therapy, that's the massage, that's the acupuncture, restoring that shoulder function. But what you've also got to do is you've got to address that counter twist action that's going on in those two levels of the neck to find out where exactly is that going on, how is it these things are going in the opposite direction, and what can you do to restore the normal motion, alignment, stability so that you can get the best results possible. So there we go, a little bit of a mouthful on frozen shoulder, and again, I don't profess to be an expert in this subject by any stretch of the imagination, but just wanted to show a little bit about what the research is saying, where we need to focus. We need to focus not only on the rehabilitation, the movement of the affected shoulder, but we also need to look at the upper and the lower neck as well. So, thanks for watching this video. If you've enjoyed it, please do click that like and subscribe button. Share this with friends, family members, clients, colleagues that you think would benefit from watching this video. And if you want some more information, you can go to my clinic website, chiropractorspokane.com, or if you are not in the Northwest Pacific area of the US or Canada, what you can do is you can go to a directory, UCC near me, or you can find somebody who specializes in this particular area of the body, help you get the health and results you're looking for. Thanks for watching. This is Dr. Jeffrey Hanna, Clear Chiropractic. Get well, live well, stay well.